been really it's been really raining around here in Lagos, Nigeria. I didn't know about your area, but we are barely trying to survive. I hope you've also been surviving. I hope you have been coping well with the pressure out there. The stressors are so enormous. But one of the things that we keep saying here is that we have to live to flourish and flourish in our mental functioning and our mental health. That way, you're better attuned to cope with the pressure, and then you are also better able to function. So once again, you're welcome to yet another episode of the Yaba Voice webinar. It's going to be a really very interesting thing today. When people talk about quite a whole lot of issues, they tell you about habits. At what point does it become addiction? When it's addictive, what can they do? How can they get up? And you know, this conversation that we're having today, there is a lot of hush about it. Even in our homes, in our families, a lot of people don't talk about it because we don't want people to know, because we don't want to be seen as having failed. We'll deal with all of those things because quite a whole lot of parents also feel like they are failed, or they're guilty about one thing they felt they should have done or they should not have done. And because of that, okay, so today we would be dealing with this very important topic, beyond habits. We look at addiction, the causes, the prevention, and also the management. Dr. Luani is here, and I'm very eager to welcome us to yet another episode of this webinar. Over to you, Dr. Luani.
Good afternoon, distinguished ladies and gentlemen. It's my privilege to welcome everyone again to another edition of Yaba Voice. This is a program dedicated to creating awareness and promotion of mental health. We've been doing this for many months now, and we are happy that today we are going to discuss another important topic, which has become of major concerns to almost everybody: parents, teachers, clergy, government officials, all over the world. It has become a major point of concern to all of us. I'm talking about issue of addiction. This problem has devastated many lives. It has derailed brilliant careers, and it has dimmed brilliant stars who have become shadows of their own selves. The UNODC, which is the international organization saddled with the responsibility of control of drugs and crime, has recently estimated that the prevalence of this problem in Nigeria is far higher than in many parts of the world. How did we get to this point? What are the causes of drug addiction? How may it be prevented? And what are the management? These are the issues that we'll be taking on today. And as usual, Yaba Voice has sought out qualified, capable individuals who are qualified to talk about these issues. The first expert that we have today is Dr. Peter Onifade, who is a senior consultant psychiatrist and drug addiction therapist from Federal Neuropsychiatric Hospital, Aro. He has many years of experience in these areas and has researched extensively about these issues. Today, we will be benefiting from his wealth of experience and his knowledge to shed light on this issue and enlighten us on how best we can handle this for the sake of the generation to come. And the second expert is Mrs. Chinyere Okonkwo, who is a senior clinical psychologist at Federal Neuropsychiatric Hospital, Yaba. She has extensive training from both within and outside this country. And she has also many years of experience working with individuals with substance use disorder. I can assure you, ladies and gentlemen, that both of our presenters today are eminently qualified to talk about this problem. And they will be delving into their repertoires of knowledge and experience to address this issue extensively. I want every one of you to sit back and listen attentively so that we can benefit from their discussion. Thank you. Over to you.
Thank you so very much, Dr. Oluwani. Dr. Oluwani is the head of clinicals and also one of the hour head of the Yaba Voice. It's people who have been pushing to ensure that quite all this information get out and people also benefit. All right, so if you know somebody that needs to be here, you know, somebody who most times you just know somebody that needs to know somebody. All right, so if you know somebody that needs to be here, please inform them that we have started yet another episode. And this is very, very, very important. If you go virtually all over the streets, the place, how just around us now, this issue of addiction. Some few days ago, one of the young, popular or upcoming artists was shown on Instagram. And I don't know exactly which of the substances he used, but you could see the way he was roaring, shouting, screaming, and people were trying to hold him down. And so it's virtually all over. Even despite the fact that people understand or see the consequences, a whole lot of people are getting into it. And that's why we're talking about this today. And so Dr. Onifade will kickstart this discussion with us for us this afternoon. And he will be talking to us on what exactly is addiction. Is it different from dependence? Is it the same thing? Is it? No, let's just understand. When we're talking about addiction in itself, Dr. Onifade, what exactly are we talking about? Over to you, sir.
Thank you very much for the question. I'm happy to be here today. Regarding the term addiction and dependence, the two terms actually mean the same thing in terms of denotation, but in terms of connotation, they differ from each other, and I will explain a bit. In terms of what they both mean, actually, they mean that so an individual is involved with psychoactive substance, and psychoactive substance is any substance that acts on the brain to alter thinking, feeling, perception, and behavior. Any substance that does that is psychoactive. So when somebody is involved with psychoactive substance, a time comes when it begins to use despite experiencing harm. Of course, at the beginning, all psychoactive substances have some benefit. So people use them for the benefits. But the time comes when they start experiencing harm. When they begin to, when they continue to use despite harm, we say that they've started the process of addiction. That is what we call harmful use. But if the person progresses, he begins to have other signs of addiction, like strong compulsion to use, neglect of other activities in his life, just so that he can get involved with the substance. And then he will begin to use increasing amount of the substance to have the same effect, which we call tolerance. And then if by any chance he is unable to gain access to the substance, he starts showing what we call withdrawal symptoms. His body will react, his psychology will react to the substance. So when somebody gets to the point that is using the substance in this way, we say he's addicted to the substance. However, addiction itself connotes, socially speaking now, that the person has a problem and is indulgent, and he doesn't want to leave the substance when he should leave the substance, that the person is illogical. Whereas dependence indicates that actually the problem is not so much of the person, but of the substance. Because at this point, the person cannot function adequately without the substance. So the person is compelled to continue using the substance because his functioning is dependent on that. Logically, somebody who is dependent on the substance, it is logical for him to continue using it. But if we say somebody is addicted to the substance, we are saying that it is illogical for the person to use it because the person has the ability to stop and is not stopping. That is not the case. Although at the beginning of the substance use, it is in the person's will. It is the person's choice to use. But when you get to the level of dependence, it is not so much of his choice to use now, because it's a disorder. He needs help at that point. So if I will use either of the two terms, I will use dependence instead of using addiction. Addiction connotes, has some stigmatizing connotations, which actually is not suitable for anybody who is living with substance dependence.
Thank you so very much, sir. I don't know if you have started picking something. Please, if you know somebody that needs to be here, tell them that we have started this webinar, and also that they can join live on Facebook. We are streaming live on Facebook too. Okay, so they can also be a part of this as well on Facebook or here. Please, let's get them involved so that they can be here. And then also, if you have questions about addiction, like Dr. Luwani said, we have the expert here with us today. They would also be able to pick up any question, whatever it is, on this topic today, and then they'll be able to address them effectively. All right, so we're going to go to Ms. Okongo, who's going to talk to us about why do people actually become addicted. Now, people will tell you, I don't want to do it. All of a sudden, they're doing it and they can't get out of it. They're crying and they still can't get out. Why do people become addicted?
Thank you very much. Good afternoon, everyone. It's actually my pleasure to be here. So why do people get addicted? Why do people get dependent? I'll start by saying that for one to get dependent on a habit, the person would have started to indulge, the person would have been exposed to it. And so when somebody is exposed to a habit, like substance use, for instance, there's a progression. And before starting, there are certain factors that make it possible to happen. We call them risk factors. So looking at risk factors for addiction or dependence, it's very important to note, because these risk factors are actually things that can help either in treatment or in prevention. Knowing them can help one a lot. So one of the risk factors, for instance, is the use in the family, positive family history of use. Imagine that somebody is born or lives in a family where the parents are using. The tendency for him or her to have favorable disposition to the use of substance or to the habit is there. And so when he sees people and there's a little pressure or influence from outside, you see that the person doesn't think it's any problem. And so the tendency to use is high. And it's from using that he starts to develop dependence. Remember, the first speaker talked about tolerance, and the progression moves on until the person becomes dependent. So the positive use in the family is a risk factor. The environment itself, if one is living in an environment where such habits or substances are very common, it will be seen as a norm, acceptable in that vicinity. And so the person may not have difficulty getting it or even trying it. And remember that human is naturally inquisitive in nature. And so sometimes you see somebody just trying to test, let's see how it is, or even adventurous ones, depending on the personality of the individual. Okay, so that can actually make people to want to start. And we can also talk about poor coping skills. People who have poor coping skills have the tendency to use. That's a risk factor to use substance. People who don't know better way to deal with issues of life, people who try to use the escapist method to deal with life challenges. You know, you into substance, and it's very common among the young ones, where their friends will say, oh, why are you feeling so sad? Why are you dull? Why don't you try this? It will make you to get over all the disturbances. And when they try it and it works, they continue to move on with it. So not being able to deal with life challenges or poor coping skill, as we put it, is one of the risk factors. Having mental health challenges. Sometimes you get to hear people who say, oh, I feel so low. And they know that they're actually dealing with something like depression. And they tell you that when they take certain substance, they feel better. and it looks like magic for them. And so they try to use it to treat or to medicate the illness. Also, for example, we've had to see some patients who said, oh, you see, when I take a wrap of Indian herb, I actually stop to hear those voices that disturb me, and I think it works. So people who have mental health challenges also can be prone or have the tendency to use substance. There is also this issue of early onset of use or early exposure. From numerous research, we know that people who start to use substances early in life gravitate towards getting dependent on that substance. And for some of us who have had to read or to uh, study substance use among the young ones, you look at the brain development, their judgment, their decision-making skill, the part of the brain that helps them to have better judgment. You see that sometimes they are not able to take proper decision for themselves. And so they are easily influenced. And that takes us to the issue of peer influence or sometimes peer pressure, to use. So a number of factors can come together or even singularly expose one to start using and then gradually progress to get dependent or addicted to the substance.
Thank you so much, ma'am. How many of us on this platform just type, yes, I did, smoked paper, you will watch movie. The next thing is you will roll paper like this. You will now light it and you now pull it in. You will start coughing. I don't know how many people went back after that, but we tried it. I don't even know what went into our head. And then we just tried it, we'll just light it. And then the next thing is we will just blow it. We'll just want to see what, modeling, see what they are doing on the television. Some of those factors, all of them, she talked about the environment. All of those things have great influence on how individual gets addicted. And that's what she had told us today. Positive history. We know we have seen quite a number of cases where they'll say, oh, my father has a bar in their house. Now, it might also be a sign of affluence to have a bar. Maybe they would also tell us about that as we move on, because we need to begin to deal with the root cause of these issues. Children will tell you that, oh, Madam Pamela, thank you. She said she smoked too. So I have a fellow, I don't know what to call you now, but we did not end up smoking eventually though. Okay. But then, we need to just begin to see how to deal with all of these things. Having
Hello, we don't see. I cannot hear you. Voice is not coming out. Hello?
It is not for your side, sir.
Okay.
All right, Dr. Olufade, please, can you tell us what are the types of addiction that we have and the severity and its severity? Thank you, sir.
Okay, thank you very much. Addiction is a word that may be used loosely or strictly. There are some, apart from drug addiction, there are other compulsive habits that people call addiction, like internet addiction, gambling, sex addiction, and so on and so forth. But these other addictive behaviors actually do not result from introduction of a psychoactive substance into the body. But when we are talking about addiction that has to do with substance, then we may be talking about addiction in terms of severity, from harmful use to mild dependence to severe dependence. We may also talk about them in terms of the specific substance that one is using. So we can have like alcohol dependence, cocaine dependence. We can also have polydrug use disorder. People actually use multiple substances at the same time, and they are dependent on all the substances. So, but generally, anybody who like we mentioned some symptoms of addiction. There are actually about 6 of them. If somebody has just only harmful use, well, it may say to be at a milder level of addiction. By the time one is having like 4 or 5 or 6 of those symptoms coming together, then one is at the level of severe addiction. And depending on whether it is mild, moderate, or severe, the intervention may be different.
Thank you so much, sir. All right, so Dr. Nifade is saying, okay, so it could be mild, it could be moderate, it could be severe. But Dr. Nifade, there was a guy that we saw here in the hospital in Yaba here who was using 25 wraps. And this guy was telling us that, oh, there was no problem with him. And he was still fine. Even when they brought him, he was still very strong. And he told us, yes, I was using this thing to, he dogs well, okay?
25 wraps or what?
Of marijuana.
Okay. Now,
so what would we consider that to be?
And he presented at the psychiatric hospital.
Yes, sir.
He definitely had psychosis. I'm very sure about that. So he had mental problem from it. Even though he said he didn't have any problem, he had impaired reality testing. So he had developed problems. But I've seen many people who use a lot of cannabis who at that point did not have mental breakdown, because we all have different levels of vulnerability to mental breakdown. Some may need to have used cannabis for like 2 years. Some may need to have used it for like 10 years before they break down mentally. But some, just a week or 2 weeks of use of cannabis can precipitate mental illness, because our genetic makeup is such that our vulnerability to psychotic breakdown is different. So, and there may be people that may use cannabis and may never break down. So, but one cannot say this particular person will use it and break down. But if you want to use yourself like a guinea pig, you can say, well, let me use it and see whether I will break down or will not break down. But that will be, you are on your own if you do that, sincerely speaking. So the fact is that that person had a psychotic breakdown. That was why he came to Yaba in the first place. Nobody uses cannabis. And I say it, I've never seen anybody using cannabis who didn't have a psychotic breakdown who presented in a psychiatric hospital. It's not possible. Because when they are using it without breakdown, their performance may actually be enhanced, their health may be enhanced, their sense of well-being may be enhanced until the negative effects of cannabis on person's mental health start developing. That is when people around think of bringing them to the hospital. Before then, they do well in the society. And there are so many people like that in the society doing well.
All right, thank you so very much, sir. All right, so people at home, the fact that you're using and seemingly looks like you're functioning does not mean there is nothing. Dr. Nifade will still talk to us more about the effects of addiction or on mental health. But then let's go to Mr. Konko, who is going to tell us what are the symptoms. What can you see? How do you know that you're addicted? You know, sometimes people will tell you, I did not know. I did not even see it. How can you see it? How can you know it? Madam Okoko, over to you.
Okay. So one thing that we know already is that people who start to use substance don't come out in the open to start. Many people who are discovered with substance would have used it for some time before they are discovered. And so we have this slogan, Mumu no they do drugs, because they have a smart way of concealing the habit. And sometimes, no matter how much they conceal it, the symptoms bring them out. And so what are these symptoms? The symptom can either be identified by the person using the substance or people around, most times people around. And what do they see? You see change in behavior, change in way of doing things. For example, you see an individual placing priority over the use of substance over using the use of substance above every other thing. For example, a man who is supposed to take his child to school but uses every morning, he doesn't care much if the child is going. Okay, so sorry about that break. So as I was saying, how do you know that somebody is using, and I was talking about placing the substance use above every other responsibility. And another one is, by the time somebody is dependent, he has lost control. So this person is not able to stop or to reduce his use, even when he knows that it's affecting him. So despite the consequences, he continues to use. Help me, I cannot help myself. They already know that they have lost control over whether to use or not to use. And so another thing that you will see is change in appearance. They don't care so much about how they look, especially when they need to use. They may not necessarily dress very well. You can observe poor grooming, even though many people groom very well and still use. But sometimes you find neglect or poor grooming, neglect of personal hygiene or poor grooming as part of the sign that somebody is using. You also see people neglecting their responsibilities. With countless examples of how people were observed or seen or identified as being dependent on substance. Sometimes you get to hear stories shared about people who use their properties or belongings to tours in order to get substance. And so there are quite a number of these pathetic stories that we get to hear from time to time, but there was this particular one, of a man who was dependent on substance, and he kept on selling things, anything sellable in the house. The wife was trying to cover and take care of the house, and at a time she had to borrow the children's school fees. Unfortunately, he found that money and took it and used it for drugs. And the children got to know, because they were sent out of school, their fees was not paid. So by the time she was able to resolve it anyway, but one day, the man got into the children's room and was looking around, and then the little daughter was standing and looking, and then said, "Daddy, please, don't sell my shoes." Because he was actually looking at those shoes, and she thought that he could actually take them and pawn for drugs. And so it makes one to be actually irresponsible, in quotes, not doing what he's expected to do, not living up to obligations, and also causing people around distress. Sometimes you see emotional reactions like irritable behavior. You see somebody getting quite irritable. You see somebody trying to be restless, losing concentration at work, missing work, coming late, not having any good explanation for what he is not doing right. And so you see them having difficulties. And most times among the young ones, you hear them dropping out of school because of poor grades. And that poor grade is because while they were using, they were paying more attention to the substance use rather than studies. And then even though some of them will tell you that, oh, it enhanced their understanding when they read, but at the end of the day, when they have to put down what they have read, it's either they stay away sleeping, they don't appear in the exam hall, or even when they are in the exam hall, everything they have read disappears because the effect of the drug has gone and everything erased. So there are myriad of symptoms that we can, continue to list and list over time. But once you see change in behavior, sometimes you see the person lying and being dodgy and getting away from real friends. What I mean by real friends are friends that actually care about you and try to help one to live straight. So you see them going with certain kind of category of friends. So you know that something is amiss. Thank you.
All right, thank you so very much, ma'am. All right, so these symptoms are meant for us to be able to look out for. It's not like you're suspecting them, but it just makes you to become curious. So we had a visit from a young man some few times ago, and just observe that he had this very large appetite. And it was like, excuse me, with the economy and every other thing, somebody is eating like this. But then all of a sudden we started just finding, tracking, and then we find out that he was using cannabis. And subtle changes, things that you would not naturally just look out for, but it's there. And that was how we got to know that, oh, it was cannabis, we got him, and other things like that. So let's be on the lookout for some of the symptoms that Mr. Coco had shared with us today. Now, Dr. Onifade earlier was talking about the individual who used 25 rams, and yes, who must have broken down with psychosis. Now, can we also look at addiction in its real sense to say, yes, does it actually cause mental illness? Does it lead to mental illness? Now, I've seen quite a lot of my patients who will tell you that, what I have is that I have a smoking problem, but I don't have addiction. I don't have addiction. I don't have mental health. And they would even tell you categorically that, no, what they have is not mental health problem. What they have is problem with what they have smoking. Dr. Onifade, is there a connection between those two things?
Yes, thank you very much. There are connections, actually, not just one. To start with, addiction itself, it's a mental disorder. It's one of the diagnoses in mental health. So on its own, without any other mental disorder, it's a mental disorder. Then two, it's possible that some psychological distresses or mental disorders could predispose to drug addiction in terms of the individuals trying to self-medicate themselves. Just like Chinyere mentioned, somebody who is having low mood tries alcohol or tries methamphetamine or tries cocaine and sees that the effect of this thing is really good with him, and it takes away the symptoms of the mental distress. He can continue to use it. That is one other connection. It's also possible that when somebody is using substance, the effect of the substance can mimic symptoms of mental illness. And in fact, some people have been mistaken to have mental disorders when what they had was intoxication to certain substances. For example, somebody who is intoxicated with cannabis or with ice, where the common drugs nowadays. I've seen many of them. When they are using ice or they have just used cannabis, they just go, they just develop they develop psychological breakdown with flourish psychosis, which may last for hours or even for days. During the time that they are displaying such behaviors, they can be mistaken to have developed mental disorder, whereas what they have is just reaction to the intoxication. And some people, they display psychotic symptoms when they are withdrawing from the substance. For example, somebody who is heavily addicted to alcohol or heavily addicted to opiates like heroin, like tramadol, like codeine, when they are unable to use the substance and they are not in an environment where they are receiving treatment for withdrawal, they can go into psychotic display, and they can be mistaken to actually have mental disorders. Whereas after a while, when the substance has gone out of their body, they come back to their senses. Then also, the certain substances have high predisposition to precipitating mental disorders in people. Cannabis is one of them. Not everybody that uses cannabis will break down mentally, will have psychotic symptoms, but many of them do. And for many of them, it takes years for that to happen. And before then, there may be some symptoms that it's going to happen soon. And then it's also possible that the problems that precipitated the drug abuse is also the same that precipitated the mental illness. Mental illness come about apart from substance, from experiencing stressful life events, loss of loved ones, loss of job, conflict with people, and so on. These can result in mental disorder at the same time, drug addiction. So somebody with such problems can develop both at the same time. So it's not that addiction is leading to mental illness, that both of them are coming from the same source. So those are the connections between addiction and mental disorders.
Thank you so very much, Dr. Onifade. You know, when I said, is there a, he said there are, as a emphasis on are. So yes. That means it's not just one. He said something very, very potent, which is the fact that addiction itself is a mental illness. Dr. Onifade, was that what you said?
Exactly. It's a mental illness on its own. Without other problems, it itself is a mental problem. It's a mental disorder.
That means there is a problem already.
Exactly.
Not to now talk about others. So this is why we're talking about this this afternoon. All right, so Madam Chinyere, if a family member, all right, please note that we'll come to the platform, we'll be able to take questions subsequently. So just please keep dropping your comments, your questions, and we will be able to take them as we go on in this conversation. All right, so Madam Chinyere, how can we help family members who is addicted? You know, sometimes it's an unconscious thing. People will start praying. They will go to MFM. The fact that your child is even doing, it's not apologies to people who go to MFM. It's not like casting stones here. No, not at all. But you know, it's like this needs deliverance. It must just be pulled out of that person. What can we do? How can we also not make it in such a way that the child eventually or the individual will not even get the help that they need to be able to get? What can be done to help family members who have these problems within their territory?
Okay, so the first thing that people do mostly when they discover that a family member is using is panic. Sometimes denial. This is not my son. This is not my daughter. This is not my wife or husband or brother or sister, you know. And because of that denial, at the initial phase, they try to cover it up. And it keeps brewing because you cannot hide a sickness. We've heard that it is a mental illness. And so you cannot cover it. You must deal with it to resolve it. And so people get to react with panic. So I will say here that ordinarily the first statement I should make will be seek professional help. But besides that, there are things that you can do on your own before you even get to the professional or before you start to seek professional help. The first thing I would say is do not panic. You may be upset. You may be, you know, you may be disorganized or surprised or disappointed or whatever, but do not panic. That's the first thing. And secondly, accept the reality that this is what is happening to this person. Because addiction is an illness and can be treated. So the reality is that somebody you know, somebody close to you is having this problem, acceptance. And by the time you accept it now, you'll be able to show concern. Let that person know that you are aware of what is happening and that you are neither condemning or blaming, but you are willing to deal with it. You can talk about it with the individual, not when the person is high on whatever substance, because for anyone that starts to use substance, there are reasons. Even as simple as just being inquisitive, that is a reason too. So you can talk about it. You will always express the willingness to support the person to go through treatment. Why am I mentioning these things as preamble to seeking professional help? Because if the person involved understands that you're already aware of the problem, he may not need to hide much from you. And it's even better if he knows that you are aware, you are not judging, you are not condemning, you are not castigating, you are not punishing, but willing to assist or support through treatment. The tendency that they will cooperate with you and even the professional that you will seek in treatment is higher. And so it makes it easier for them to go through the treatment process. So before you get to the professional, which you will definitely do, you have to do your own homework first. Remember that if you approach it initially by getting upset, seeking all kinds of counsels to cast and people start to condemn, the individual involved can recall. The person can, withdraw and not open up and start to hide a lot of things, including reason for using or even continuing use. So it's always better to take it easy. It's already a problem. Solution will surely come, provided we do the right thing.
Thank you, Madam Boboko. I don't know how it sees you, but when you just see your child smoking, and he's smoking weed, and you have in your mind seeing the future from the beginning that you are seeing now. Not shouting, that not shouting will take grace. So, how do we train ourselves? I want you to quickly talk about that. How do we train ourselves not to shout? How do you tell yourself not to scream? It's like your word has ended at that point in time. I've seen parents who had complained like, I am finished. That's the first statement. I say, Mr. Kito, I am finished. I caught my son smoking. How do we train ourselves to, just that calm? I love this, your calm. Is that same calm that we will maintain at that point in time?
So when I say don't shout, don't panic, I didn't mean that you should not react emotionally or naturally, but as much as possible, do not let it be your whole reaction to the situation. You can get by yourself and release all the emotions you can. You can even initially react like that, but take a pause and come back, because if you continue to react like that, you're not going to achieve anything. Remember, anybody that responds in anger does not give the best response. Anything that you want to solve as a problem, you don't approach it when your emotions are too high. You'll calm down first for you to have reasonable approach to deal with it. So that's exactly what I mean. You can express yourself, but remember that's not the solution to the problem.
Thank you so very much. I'm going to just take some bit of questions, comments here. Professor Izinwa, thank you. We're happy to have you here with us today also. Yes, Madam Pamela responded to yours earlier. Are there any program for sexual addiction? Yes, there are lots of programs, and that's part of what we do at Yaba, the Federal Neuropsychiatric Hospital, Yaba, Lagos. All right, so you could walk in and then assess care for this also. Okay, sorry, the person who said they weren't connected by audio. I hope you can hear us now. All right, Oluroti Ojela did share the personal story about the son who was suspected to be using in 2017. She reported him to Professor Olurotimi Kuka, and he went ahead to tell him about the harms and the danger. I said, what a wonderful step I took. He is now a well-behaved young adult to the glory of God. Praise God. All right, so thank you for taking that step at that time to be able to help yourself. Yes, are there any program for sexual addiction? Yes, there are. We will be here and readily available to help you at the Federal Neuropsychiatric Hospital, Yaba, Lagos. All right, so Uzesi is also asking again, if a child with addiction problem needs help and cannot afford to pay for treatment, are there any funds available? Dr. Luwani will talk about the fund after now. So I will leave that question for him. Dr. Luwani is here. He would answer that. Are there programs for sexual addiction? Yes, I have told you. We do that here at the Federal Neuropsychiatric Hospital. All right. She also said again, it's so true. It's very difficult when it's close to us, when we have relatives that have issues. Honestly, it's really very, very difficult. Dr. Sombre says, thank you. Addiction should be taken to a level beyond substance abuse. Gambling is another addiction. B, well done, guys. Thank you. Dr. Nifade started with that today. Even though, yes, he mentioned the fact that when we talk about addiction in itself, it's about substance, but there are other forms of addiction. We talk about pornography, the gambling, and quite a whole lot of other things like that. But then Dr. Nifade now will be talking to us and telling us, is addiction treatable? Now, it's like people give up hope and they don't see a way out of it. But then, is it treatable?
It is very, very treatable, very much so. And I want to emphasize that it is actually, despite the fact that some people don't believe that it's treatable, it is very much treatable. And in fact, it is possible for some, though not so many, of people who are addicted to recover on their own without any intervention. It's very possible. There are just some ingredients that are needed for recovery to take place. Even those that will recover via treatment, we also need those three elements. Without those elements, it's not possible to recover from drug addiction. These elements are one that is required to have what is called turning point event. A turning point event is any negative experience from the substance use. Could be, losing a friend to substance, or being expelled from school, or being involved in an accident after being drunk or something. Turning point event. And that turning point event must be met with idea of change and of self-rescue. Effective ideas of change and of self-rescue. And then the third one is self-acceptance. In fact, all treatments that are effective target these two elements. Two out of these three elements. But the first element is what will happen for anybody come for treatment in the first place. But idea of self-change, ideas of change and of self-rescue is critical, and self-acceptance is critical. And some people, by trial and error or one way or the other, discover this on their own and they are able to recover. But generally, when we talk about treatment, people think that treatment is not effective, don't understand what the treatment outcomes are in drug addiction treatment. Generally, there are two groups of treatment outcomes. People in the population focus only on one of them. The first one is, first of all, let me just say that the goal of treatment, according to WHO, is to help for any disease, not just drug addiction. It's a series of interventions to help people attain the highest, to have the highest attainable level of health and of well-being. The level of health has to do with symptoms, but it doesn't have to do with absence of symptoms alone, okay? And then the sense of well-being, there may not be symptoms, but somebody may not have good sense of well-being. So intervention will seek to promote the two. Now, for drug addiction, one of the goals is what I call the primary goal is cutting off or cutting down the substance use. This is what everybody focuses on: cutting off or cutting down. Some even don't even believe in cutting down. They just say they must cut off. Yes, I believe in cutting off, but at times some people are unable to cut off suddenly. So we begin with them to cut down, and then from cutting down, they cut off. That is the primary goal. Now, it's possible. Along with this is drug addiction generally is associated with some problems that are not related to drugs. Either the problems led to the drug addiction or the drug addiction led to the problems. Family problems, legal problems, educational problems, problem with emotions, mental problems. Now, all these associated problems, they are what we call intermediary outcomes. Without taking care of them, the primary outcome cannot be achieved. For example, somebody who has pains in the body, or somebody who has mental problem, for example, has depression, for example, and is using cocaine to take out the depression. You focus on cocaine, you don't focus on the depressive symptoms. You are just wasting your time. So, but if somebody came with drug addiction, I've taken care of his mental problem, I've taken care of his legal problem, taken care of his family problems, I've taken care of all the other problems, but maybe after a week or two, or maybe after a month or 3 or 4, the person now relapses into drug addiction. Somebody will say the treatment is not effective. It's not so, it is effective. And in fact, relapse is not an indication that treatment has failed, because we use relapse itself as a point in treatment. So it's not anything therapists are afraid of. It can happen, but we use it to bring the person back into abstinence. And the experience is that when somebody is abstinent after treatment, in the period that is not using, is fighting against all the triggers that will make him to use, and is winning. So that means he has won many battles before the time of relapse. So all we need to do when he relapses is to say, well, you've won many battles, but you faced a particular trigger and this made you to relapse. Let's consider this particular trigger now. And you take him through a kind of training or reprogramming, and then he masters that trigger, and then he goes on in life. So he may come back, he may get to another trigger maybe in the next 10 or 15 years or so that may floor him. It's not to say, well, that treatment failed. Just, okay, now that you relapsed again, what were the problems, what were the triggers, and we use that also as point of therapy. And in so doing, the person who has great quality of life compared to somebody who is still involved in substance use. So what I want to, the key message I want to pass across in terms of treatment outcome is that treatment works, but relapse is not an indication that treatment has failed. It's a point for recovery. It's a point for treatment. Now, let me give you this analogy. You have a child who is learning to walk, maybe 8 months or 9 months or whatever. If the child stands up and take a few steps and falls, would you say the child has failed to learn to walk? No, the child is still in the process of learning. And drug addiction, it's a lifelong problem, and recovery is forever. The person will be in recovery forever. The person must never lower his guard. That is why it's such a thing that should be prevented than treating. The person, as long as the person is not off guard, he can maintain his abstinence. But once in a while, we all lose guards. Things happen to us. Many things happen to us. We just want to just give up. And at such a point, the person can relapse. Not because he wants to, but because a trigger came to him and he just couldn't master that trigger. So treatment works. Relapse is not an issue. Everyone that relapses should be encouraged to get back to abstinence. That is the thing about treatment of drug addiction.
Thank you so very much, Dr. Onifade. I love the fact that he also ended with that high note. And that is the fact that when an individual has a relapse, it doesn't mean that they had gone out of the old track. And so they can just be redirected, and then they can get back on track, and then they are able to focus and function effectively. Yes, as I said, yes, relapse happened, but getting back on track is always possible. Dr. Ngozi Ukeji said, first of all, we need to change our cultural norm of stigmatization and to say things like, it is not our portion. That is how we are framed. God will deliver us. And then secondly, we need to also realize our world today is very different from the world yesterday. I completely agree with this. And thirdly, understanding that help is available and be intentional in seeking out help. Yes, access, availability of help, and access to it now, it's so enormous now that you can easily just speak and you can come in. And that's what we do here also at the Federal Neuropsychiatric Hospital, Yaba, Lagos. I was just saying that is also very true, Dr. Okeji. But how do we educate people about this? And this is part of what we're doing. We're intentional about doing and getting the word out there. We tend to do so much in the coming years by God's grace to be able to see that people get this information. But when Dr. Onifade was talking earlier, he mentioned the fact that the intermediary outcome or the problem associated with this drug use. And I just have a flash of people who stays under the bridge, who don't have house. They don't have parents. They are not going to school. They don't know. How do we help them? We'll come back to you, Dr. Onifade. But how do we take away this problem so that then we can take away the substance? Because if we preach to them and take away the substance, and they are still back into that same environment that is not welcoming, that is not helping, that is not, Actually, look at what's happening in our world today. A lot of students are out there. They're not going to school, so they're idle. Because they're idle, they are easily influenced. What can we do? How can we help all of this? Now, let's quickly go to Madam Okoko, who is going to tell us some of the preventive strategy. We have children and people around us who have not started at all. What can we do? How can we prevent them from getting into this vice?
Okay, so I would like to say that prevention in addiction is not only for those who have not started, it also involves those who are using, because when you want to prevent relapse, you are actually trying to prevent the use as well. So there are actually three categories of prevention. We have the universal, which includes everyone, whether you have started using or you have not started using. We also have the selective. The selective prevention has to do with target group, people who are at high risk of having this problem. Then we have indicated. Indicated is for people who have actually started using, maybe undergoing treatment and trying to prevent relapse. And so in all of this, there are three major things that could be done. The first one, I see people talking about awareness creation, information dissemination. That is actually very, very important, because that's one of the things that you do to reach majority of people. You allow people to gain knowledge. And so one emphasis that must be taken note of in information dissemination or awareness creation is the content. Now we know that just going out there to address people and tell them that, oh, substances are bad, certain habits are not good, it's not sufficient. You will have to talk about other things. For example, you could also educate people about some of the risk factors that surround them, which they may not be aware of. Some of the tendencies that they could have, some of the attributes or things about them that could actually predispose them to using or continue to use. Some people don't understand why they go back to use even when they have said they don't want to. So part of the education or part of the information that you want to disseminate is teaching people some of the things that make them vulnerable to this habit. And then another one is engaging people. We know that the idle mind, they say, is the devil's workshop. And one of the key factors in relapse, for example, is idleness, not being functional. And so getting people engaged, getting people busy with activities could actually help prevent. For example, if you want to talk about or deal with prevention among adolescents or people who have not started now, you will want to come up with activities that will make them busy enough not to have idle times to talk about issue of substance or mix with people that use and have time for that. So in prevention, you don't just focus on the substance, you also make people to develop skills as well, skills that will keep them busy, skills that will task them and help them to burn the energy instead of using it to idle away. And then the third leg in prevention is helping people to learn appropriate ways to deal with life challenges, encouraging good coping strategies. Because most people start to use is when they are in search of a way out of problems. And so if people learn that there are possible ways of resolving life issues without using substance, many people will not indulge. So in trying to prevent, you give information, that's awareness creation, and the information has to largely cover things that will help individual to gain better awareness of self, okay, and to know whether he has the tendencies and to watch out for them, okay. Secondly, encourage people to be active, to be engaged, to be functional, to be productive at whatever capacity, either as students, let them be in school. Unfortunately, some of these things are not working the way. The facilitator just mentioned the issue of students being at home for long. only one can imagine what has been going on with good number of these students. These are young people. These are people full of energy that cannot exhaust it in any way. Few of them may be able to engage in productive activities, but a good number of them, by the time they go back to school, they may not be the same persons that left school. So leaving gaps, and then the third one is helping people to learn better coping skills. That, to a large extent, will help us to prevent this level. And don't forget that prevention is not just about not starting. Even those that have started can actually still prevent use of whatever substance.
Thank you so very much, Mr. Konko, for that. Quite a whole lot of comments about these, people sharing their thoughts on how to prevent. Yes, more awareness program, parent forum, list of community services, resources that can be provided. I will look up, check that out, and then I'll be able to send that to the Yaba Voice platform. So you can access that. I don't have that readily available now. Ms. Oye, thank you for this. When you are informed, you can inform others. Good advocacy. Let's continue with you too. Dr. Ngozi said, yes, for our young adults, getting them involved in volunteerism, working, wonderful way to get back to our to give back, to our communities and develop our country. Yes, ADDICTION said we should also encourage those who have been wind up substance abuse to change their environment when it is possible. Now the word is when it is possible. This is to take them away from friends and associates with whom they have been involved with drug use, yes, in the environment. I completely agree with that. When it's possible, we're able to just, otherwise we give them skills that will be able to allow them to just function there. Yes, Anastasia said, wonderful presentation. In Southeast Asia, where I work, a lot of the people are highly dependent on alcohol and nicotine with little or no knowledge about the effect. The men believe that they are strong and can handle the situation. How can I help them? Dr. Onifade, how can she help? Southeast Asia, they use it so much, but they believe it has no negative consequence. So how can this person help?
Well, it's really a difficult thing for just one person to help, but it takes one person to start the help chain. So I think the first thing that may need to be done is to call the attention of the community, some stakeholders, and the government and treatment facilities in that area to the problem. That may be the first thing the person can do, because it's really a very terrible problem that only one person only cannot do. So please just get the stakeholders around, call their attention to it, and have a joint effort to. I'm sure in the area there will be some treatment facilities that have the capacity for preventive programs and treatment programs. I think those people should be contacted first, and then you pick it up from there.
All right, thank you so very much, sir. It starts with one person. One person
Yes.
can make change, and that's what I heard Dr. Onifade say
Yeah.
this afternoon. All right, so awareness, curation, and all of those things, opportunity to talk, just opportunities that arises. Just keep sharing those thoughts, and then we can only just hope that we're able to change our world. Quickly, please, let's unmute Dr. Luane, who's going to give us the information on if there are people who want to access help, but they don't have money. Is there anywhere they can go to? It's my guy can answer that question. Me, I don't have the power.
Thank you, the moderator. The question is if there's any fund, or let me be sure. Let me start by saying this. I want to encourage that issue of finance should not prevent an individual from seeking help. The first step to be taken is for you to come, at least talking from our own point of view, to discuss with us for assessment. I'm not saying by that we have a fund kept somewhere to give out, but you discover a lot of time is information that is most important. When you get here, you have somebody who have such challenge, let's start talking. Let's assess the individual, and we should start from there. Having said that, I know that the hospital, in conjunction with some philanthropies, from time to time, we have a small amount of money kept apart for indigents, those who are not able to help themselves. And there are criteria to assess these. From time to time, this is also made available. And we have a Department of Social Work, who part of their responsibility is continuously try to link individuals who are not able to finance their treatment with well-meaning Nigerians who are able to do this. The result we get varies from time to time, but the point I want to establish here is that don't let it be, well, I don't have money, I won't come. Come, take the first step, and from there we see how it goes. Thank you.
Thank you so very much. You see why I said it was the guy that should answer this now. Okay, so what he has said, and which is very germane, is the fact that come first, let assessment be done, then help will be provided, however way it is, whether they allow no fund, whether the social work will have to connect with the student, something at least would be done. So come, don't let money or fund restrict you from accessing the help that you need. All right, so we have wrapping up on this wonderful discussion for today. We'll also just take one minute comment from our speakers today. All right, Dr. Odifade, just your last assessment is not free. Okay, the initial assessment, Dr. Luwani, they say, is the assessment free? Please, Dr. Luwani, is assessment free? The psychiatric evaluation, I guess that's what it's meant.
When we talk of assessment, there are many things involved. And like I've said, I think it will not be responsible on our part to tell people here that, well, don't come, because come, I mean what I'm saying. If you have an issue, come here and let's start talking. That is the first thing. Whether assessment is free, assessment is not a single procedure. There are many things involved, but we assess your situation and we'll be able to advise and take appropriate steps. So that's what I want to say.
Thank you so very much for that. All right, so Dr. Onifade, let's take the last comment from you, sir. Dr. Onifade.
Yes, thank you very much. On a final note, I'd like to say that addiction may sound intimidating, but it's really nothing to be afraid of. We should address it headlong, and it's something that is solvable. Individual efforts, community effort, government effort, when everything comes together, we can actually address it and take very good care of it. So please, let us not stigmatize people who are living with the problem. Let's help them out, because the thing is treatable and it can happen to anybody. It can happen to anybody. So don't say it's their fault, it's their weakness. No, it can be anybody. So please, let's rally around everybody with the problem and help them out and make effort to prevent other people from getting to the problem. Thank you.
Thank you so very much, sir. It could be anybody. It could be anybody. And so if it does happen, it's also not something to just push and shy away from. Getting help is the best thing. All right, Madam Okonko, over to you, ma'am.
Okay, so I will say that just as Dr. Onifade has said, when a problem is known, the solution is partly found. So since there is solution, we should actually seek help and play less on what we imagine will be the problem. And for people who have not started at all, I think if you have not started, it is still the best. Don't even start, because it's better to say, lead me not into temptation, than to say, deliver me from evil. The two statements are quite different and significant. So if one has not started, we should put more effort in helping people not to start at all. Let's try to reflect on those points on prevention so that we can help people better.
Very much to our speakers today for being here. And what I hear Ms. Okoko said is the fact that if you have not started, don't even start at all. Let's circulate this message. Let's be ambassadors. Let's go all out there to help people understand that when we're talking about addiction, it's a mental health problem. Dr. Nifade told us that it's mental illness in itself, not to now talk about the additional consequences that now comes that is attached to it. So please and please, let's create more of this awareness out there. The influence are there high, it's really high, really, really high, and people are just finding ways of coping and every other thing with the use of substance and then creating more problems for themselves. But with their adaptive way, there are better ways of handling issues and create just getting out of this difficult situation. And so on this final note, we want to say thank you to everyone also for being on this call. We love it each time that we roll out like this and then you're there, you're helping us and making us to feel, yes, we're doing something very important. Thank you so very much for being here on this call with us. On behalf of the medical director, the head of clinicals, and every member of the Yaba Voice team, we want say thank you so very much. Please watch out. The 10th of October will be the World Mental Health Day, and the theme this year is making mental health and well-being a global priority. It starts with the individual before we can even go global. And so everyone has to make sure that they make their own mental health and well-being, emotional well-being, a priority. And then we'll look at some of those issues surrounding or challenges coupled with that. But then we're also looking at doing something very nice. Please watch out on the Yaba page, and then please be on the YouTube, the Facebook, the Instagram, and many other things as well. On past episodes of the Yaba Voice webinars are also posted there. And so if you have missed or you love to also listen again, please connect with us. On this final note, please ensure that you keep flourishing and ensure that you are there. Oh, yes, indeed, I said therapy for the therapist. Oh, yes, everyone needs therapy at one point or the other in their life. All right, so on this final note, I want to say thank you so much for joining. Until we see you all again, take care of your mental health, stay safe out there, ensure that you're coping adaptively, and if you find it difficult to cope, we are here to listen and to help you. Take care of yourself. Bye-bye.
Bye. Thank
Bye.
you. Bye.
Thank you.
Bye.